So although thankfully the perimenopause and menopause is becoming less taboo, there's more information out there, there's more articles in newspapers and magazines, there are still some embarrassing symptoms that you don't want to talk about, never mind to friends or loved ones, but the thought of going to the doctor just fills you with dread. So I thought I would talk about some of the common ones. So these are ones that I'm getting lots of questions about regularly, and what you can do to help yourself. So number one is urinary incontinence, if I can say that correctly. So this is basically when you unconsciously pass urine, maybe when you run or when you laugh or when you do sports, anything where you're moving a little bit more than normal. It could also be that you're fine 1 minute and the next minute you're absolutely desperate to go to the toilet and you start to leak before you can get to the toilet. So there's two main factors here. One is just age itself. As we get older, the bladder valve, which we can normally control, becomes weaker. So we're less in control of our bladder generally. And any little bit of extra pressure can just make us leak that little bit of urine. Second reason is that as our hormones start to fall, and especially estrogen has a weakening effect on the bladder generally as well. So again, we can't control things as much as what we used to do before. The other things that can happen here is something called a prolapse. So this is where the bladder, so we've got pelvic, what we call the pelvic girdle muscles. So these are muscles that are slung between each hip, and they hold up, it's a bit like a sling or a hammock. They hold up the bladder, the bowel and the womb. But what happens as we get older is that these muscles become weaker, so that the organs in this pelvic area can slide or shift a bit. So the bladder can end up shifting position. It can end up getting squashed by the bowel or the womb. And that makes it much harder to get control of the bladder too. So if you find, especially if you're getting a dragging feeling, then it's really important to get this checked out by your doctor. And as I said before, we don't like to talk about these embarrassing things with the doctor, but this is really important because the bladder can shift, and if your pelvic girdle muscles weaken too much, basically things can fall through the vagina. So any kind of discomfort when you're sitting, any kind of dragging feeling, then it's really important to get this checked for a prolapse. The other thing it can be is just dehydration. So when we get dehydrated, the bladder can get really irritated because the urine gets very acidic and very concentrated. So, we have this situation where we're leaking, we're sort of going to the toilet when we don't want to. So it seems logical, if we don't drink so much, we won't go to the toilet so much, but exactly the opposite happens. So it's really important with this urinary incontinence that you make sure that you're drinking plenty of water during the day as well. Really, really important. The other things that can help is Pilates. This is one of the very few exercises or anything that will help to strengthen the bladder. So if you can find an experienced practitioner in your area, they can teach you really specific exercises to do. I was told by a really experienced Pilates instructor many years ago that doing things online, going onto YouTube, you can end up doing the exercises wrong because you're not quite sure what you're supposed to do. So this is one instance where I would say, go and see an experienced instructor. They can show you very specific exercises to do. And I know that Pilates for women and Pilates for pelvic health, they are becoming much more popular now. So this is one of the best things. And for those of you that are just approaching the perimenopause or the menopause, preventative medicine is better than waiting until something happens. And weak bladders, bladder incontinence. The older you get, the more common this becomes. So doing preventative work, learning how to do these exercises before things get too bad, it's worth its weight in gold, definitely. Number 2 is vaginal odour. And again, this is another one of these common ones. It's a really embarrassing one as well, because you don't know if other people can smell you too. So it can be a very embarrassing one. What happens here is we have loads of friendly bacteria in the vagina. So they're not just in the digestive tract, which we all know about these days. So our vagina has its own mix of friendly bacteria, and these help to keep the bad bacteria and things like thrush and candida at bay. But the friendly bacteria also help to keep the mucous membranes of the vagina nice and healthy. So when your estrogen starts to fall, the level of friendly bacteria can deteriorate, so the baddies can get in, they can take control, and they're the ones that tend to cause a lot of odour. So it's really important here to take something like a vaginal probiotic. Can be really, really helpful. And especially if you've had things like bladder infections, you get antibiotics. Antibiotics can end up killing off the friendly bacteria in the vagina as well. So a daily vaginal probiotic can, make a huge amount of difference. If you find that there's a lot of discharge, if it's smelling really bad, if it's very discoloured, again, it could be something like thrush, could be something else that's going on. So again, swallow your embarrassment and get to see the doctor about this one. The other thing in this situation, natural underwear, sort of things like cotton. So make sure the whole area can breathe, and avoid chemical shower gels and soaps and things. So go for really natural soaps. Olive oil soap seems to be a really good one, and it's nice and moisturizing, but get things as pure as you can in this situation. The other thing to remember is that your sense of smell can change too. Your sense of smell can become much more accurate. It can become much more sensitive. So just be aware that your vagina odour may not have changed, but you're just that much more sensitive to it. Number 3 is hemorrhoids. I'm getting a lot of questions about this one at the moment. So the other name for hemorrhoids is piles. So this is basically, it's a bit like, when you have varicose veins on your legs, the veins distend and they start to bulge out the back of your leg. With piles and hemorrhoids, it's basically veins in the bowel that start to stretch and distend. It can affect bowel function, and sometimes the hemorrhoids can actually peep right out as well, which can be very, very sore and uncomfortable. The main reason for this is that our digestive habits change. So we can become a bit more constipated, a bit more sluggish. When that happens, you're maybe straining a bit more when you go to the toilet. So all of that can affect the veins in the bowel. Really important thing here, loads of water, because that will help with any kind of constipation. Make sure you're getting plenty of vegetable, plant fibre, wholemeal bread, pasta, things like that. They can actually cause constipation, so they're best avoided. Other things like a good prune juice, a little bit of prune juice every day can sometimes make a great deal of difference. The really important thing here is, though, if you notice any blood when you go to the toilet, if the hemorrhoids do pop out, again, swallow your embarrassment, get this one checked out by your doctor as soon as you can. The other thing that can help is there is a herb called horse chestnut, and we know that that can be very helpful for varicose veins, and it may also be helpful for hemorrhoids as well. So it might be worth a little bit of a try for a few months. Hope you found this one helpful. It's one of these situations, we don't like to talk about these things, but if they're left, they can result in things a little bit more serious. So this is one situation where you do need to maybe go and see your doctor. If any of you have any other embarrassing symptoms that you don't really want to talk about, please mention them, and hopefully with this one, there's a whole raft of embarrassing symptoms, so I can certainly do another one on other common topics. Until then, have a lovely week.